Hi, Joe.
Yes,
Hi, I'm Annie. I'm a level 1 student. I'm here to actually shadow you today, if that's okay with you.
that's fine with me, Annie. Good to meet you.
I understand you're working on a patient right now. Can I get an SBAR report on that patient?
Sure you can. This is Shanana O'Connor. She's a 34-year-old female. We're at room 231. She is 5'9", 177 pounds. That puts her at a BMI of 26.1. She is a full code. She's allergic to trimethoprim sulfamethoxal. Her physician is Dr. Engelbert. She has diabetes mellitus type 1 and end-stage renal disease. She presented to the emergency department today at 5:30 in the morning with fever, chills, and general malaise or fatigue. The patient reports elevated blood glucose readings and decreased appetite for the past few days and minimal urine output for the last month. The patient has a history of renal failure secondary to diabetic neuropathy, hypertensive nephrosclerosis. She's been undergoing scheduled hemodialysis 3 times per week for about a year, and she just got listed on the transplant list 6 months ago, which is very good for her. She is oriented to person, place, time. She's cooperative, alert. She's ambulatory but reports numbness and tingling in her lower legs. That's probably related to her diabetic neuropathy. She also reported a generalized ache and pain on a level of 4 out of 0 to 10. But she was given an acetaminophen at 6:30, so that should have controlled the pain. We're going to check when we go in there.
Okay.
Let's see. She has clear lung sounds with a productive cough. The patient denies any chest pains or palpitations. She has active bowel sounds in 4 quadrants. She's on a renal diet and oral fluid restrictions of 1,500 milliliters per day. She voids on her own, denies pain, burning, or difficulty with urination. Her urine has been cloudy and amber, and that's probably due to her decreased thirst. Urinalysis was run on her, and it came back positive with white blood cells in her urine. She's on INO, and she's being monitored each shift. She has an IV, an 18-gauge peripheral IV in her right median vein. She also has an AV graft in her left forearm, both of which are clean, dry, and intact, but we're going to double-check those when we go in the room.
All right.
Last set of vitals was taken at 7:30. She had a temperature of 101, 95 heart rate, 20 respirations, and 96% oxygen saturation on room air. She also had a blood pressure of 138/78. Her last glucose reading was 155. The medication she's on currently is calcium carbonate chewables, renal multivitamin, 1 tab by mouth daily, clonidine, and glargine on a sliding scale. And she's also on atorvastatin.
Okay.
Oh, I'm sorry. And she also had blood work done, and she came back with a white blood cell count of 12,400, which is indicative of infection.
All right. And you're going to be giving her some medication now?
Yeah, we're going to be giving her some antibiotics.
All right. Why specifically is this client receiving this medication?
Because her vital signs and lab results indicate that she has an infection.
What action does the medication have on the body?
It's a broad spectrum antibiotic or anti-infective. It's imipenem-cilastatin is what we're going to be giving her, and the imipenem binds with the cell wall, resulting in cell death, and the cilastatin basically keeps renal inactivation, which allows the imipenem to do its job.
Okay. Now, when should you question administering this medication?
You would question administering the medication if the client's not showing signs of infection, like increased temperature or white blood cell count. You would also question if the patient has a previous history of multiple hypertensivity and seizure disorders.
Does the medication have a therapeutic serum level?
No, there isn't a therapeutic serum level for this medication.
What vital signs would you want to monitor?
You'd want to monitor really all of her vital signs, but temperature and heart rate would be the ones you would want to pay particular attention to.
What about physiological parameters? What would you monitor there when this medication is being administered?
Again, you'd want to monitor her vital signs and her creatinine clearance as well, particularly with this patient since she has renal failure.
What interventions would you teach the client to ensure that the medication is being administered safely in a hospital setting?
Well, in a hospital setting, the patient is essentially the last line of defense. They're the final check. So you want to teach them what their medication is. First of all, they should be familiar with the names of their medication and also what they look like so that they can recognize if they're getting ready to receive the wrong medication.
What interventions must be taught for taking the medication safely at home?
Well, because this is the IV medication, she typically wouldn't, or any patient wouldn't be taking it at home unless they're on home health care. But again, you would want to teach her the signs and symptoms of infection, so elevated temperature, elevated heart rate, so that she could recognize this if she gets a flare-up when she's discharged, so she can get back and get medical attention.
All right. Now, what are the side effects and potential adverse reactions with this medication?
The primary adverse reaction would be anaphylaxis, which is an allergic response, a severe allergic response. She would have like a rash, laryngeal edema, wheezing. You'd also want to look out for seizures and diarrhea, which would be an indication of C. diff.
Now, how would you know that this medication is effective?
Well, we would continue to monitor her vitals, and we would see a trend back to her pre-infection baseline, which would be a normal level for her.
Okay, those are all the questions that I have for now.
All right, let's go ahead and see Miss O'Connor then. Miss O'Connor, can we come in?
Yeah, of course.
Hi, Miss O'Connor. I'm your nurse today. I'm Nurse Joe, and this is Annie. She's a level 1 nursing student that shadowed me today. Is it okay if she sits in here and watches?
My name's Amanda. I'm going to be your nurse for the night.
Just go ahead and
This is Jessica.
fire up the old computer
She's
here.
a level 1 nursing student. She'll be following me. So are you any...
So how have you been doing today?
I've been doing all right.
Now, I know that you got,
Okay. Are you in any pain, Miss Yarn?
you received some acetaminophen earlier for pain.
And I'm here to give you your gentle...
What would you say your pain is right now on a scale of 0 to 10? 0 being no pain at all, and 10 being the worst imaginable.
I'd say it's 1, but
About a 1?
yeah, it's fine.
Okay. I'm going to start with your IV med, your potassium and monosaccharide.
Okay, and you are going to be getting imipenem cilastatin today, which is a broad-spectrum antibiotic, and it's going to be given IV piggyback with some normal saline. I have a printout here for you on imipenem cilastatin, so you can read up on that as I'm getting everything ready.
Oh, nice.
And once I get this set up and everything, I'll come back later and answer any questions you may have on it.
Okay.
Let's go ahead and put some gloves on. Now it says here that you have an allergy.
Yes, I do.
And let me just look here. It's, does...
The trimethoprim
sulfamethoxazole?
sulfamethoxazole. Yeah.
There you go.
It's hard to say.
Yeah. You pretty much knocked it out of the park. It's almost as if you're a nursing student or something.
Right? I could be at some point once I get that transplant.
All right. So I'm just going to go ahead and take out all my supplies, make sure I've got everything here before I really start anything.
Okay.
Okay, we've got the sodium chloride, and you want to check the expiration date, whether it's clear or cloudy. You want to give the bag a gentle squeeze, make sure there's no leaks. So we've got the sodium chloride. I'm just going to set that here.
Oh, okay.
I've got a sodium chloride flush all ready to go here. And we've got the imipenem-cilastatin, and we're just going to check here on the MAR that is correct. And again, you're just going to check the expiration date and the color of the liquid. Make sure it's good. Give it a gentle squeeze. Make sure there's no leaks. So we're good there. And make sure my tubing is good. It's still in its package. It's got the cap on it. Don't think I need a catheter today. And I've got an IV piggyback. And before I do anything, you take these out of the packages, boom, boom. I'm going to go ahead and put my labels on here because whenever you hang IV tubing, you have to have a label with the date and the time that you hung it, as well as your initials, because it's only good for 72 hours.
Oh, okay.
So I'm going to go ahead and get my labeling done now. And there it goes. All right.
Label it.
And whoop,
Got
what is
72
that?
hours.
Now that I've got everything. I'm going to check. Can I see your ID badge, please?
Which one?
Your name ID badge.
Okay.
And can you give me your full name and your age, please?
It's Shanae O'Connor, and I'm 34.
You are correct. Yeah, that is correct. And we're going to do sodium
Can I
chloride.
check the expiration date?
And I did that wrong, so I'm going to do it all over one more time. Just making sure you're on top of your game. Okay. And one more time,
So
just
it's going on her right hand, not
Well-
left hand.
Shanae O'Connor, and I'm 34 years old.
all right. Sometimes these computers, I tell you.
And I'm just going to hand her gentamicin.
All right. And before I do that, I just want to check your IV site. And it is clean, dry, and intact. And can I go ahead and see your left forearm too? I want to check your AV
Sure.
graph. And that also is clean, dry, and intact. Now I'm just going to go ahead and clean her port. So I can go ahead, I'm going to check to make sure it's patent. Take off the cap here. And we're just going to screw that in. And undo this key. Now let me know if you feel any pain or anything.
No, no
No
pain.
pain.
It's just kind of cool.
Okay. Cap that back
You want to do it
off.
a little bit less on
Okay.
your back, so it doesn't run
All right.
through so long.
So we're going to go ahead and give the medication now. And I know I'm going to be giving piggyback, so I'm going to go hang this low. Actually, I'm going to spike the bag before I hang it up there. And remember, this is sterile, so you want to keep the spike clean and the end of the tube clean. So I'm going
Okay.
to take off this cap. Take off this cap. And I'm going to spike it right there like that. Before I pick it up, make sure my roller clamp is closed. And it is.
Do you know any of the side effects of this medication?
No, I don't really know.
Okay.
This
And you just want to fill that drip chamber about halfway.
Okay.
Fever, if you feel like you have a fever.
And now we're going to go ahead and prime the line.
I'm going to check the expiration date on that one. It's going to run over an hour. So this antibiotic's going to run for an hour. And then we'll switch back to your normal one. So can I get your name and date of birth again? Okay. So the side effects you're going to watch for are a fever. If you feel like you have a fever starting, let us know. You're also going to watch for vertigo, which is dizziness while you get up. Muscle paralysis, cramping. If you're hearing just funny, let us know.
Okay. We're just going to check the line for air bubbles. And we look good. It was kinked pretty bad there. This must be an older tube. Okay. Okay, I'll just clean both of these. Clean your cord again. And you might want to step around so you can see me what.
Okay.
Okay. So this is not a new patient. We are on the med-surg floor. We are doing a one-channel pump, so this is going to be channel A. We're doing a basic infusion. The rate is 30. And even though we have a 1,000 milliliter bag, I like to set it for like 950 so the alarm goes off a little sooner and I can get in here.
That makes sense.
And we're going to hit start. And then I'm going to hit pause right there. So that I can go ahead and hang your the actual medication. And I'm going to need it too. Go ahead and bring this up. Take a second here. Okay. I'm going to need to scan your armband again and have you go through, make sure I'm in the field. Okay, go ahead and give me your full name and date of birth.
Shanae O'Connor,
Your
and
age.
I'm 34 years old.
All right, that'll work. And the phencylastatin, and we are good.
What time is the medication due?
It's due at 1,600.
Okay.
So now we're going to set the pump for this medication.
That's what they tell us in school.
Alrighty. Now we're going to do essentially the same steps. Going to check the line first off. Make sure there's no kinks like there were on that other line. Get that taken care of now.
It's going to start over 1 hour, and now you're going to see the rate
And
change.
go ahead and get ready to spike that. That's just beeping at me, letting me know it's still paused.
So then the rate change.
And
now,
again,
so you're
this is a
gonna
sterile
press
procedure.
again.
There we go.
With this medication, make sure
Hang
you're
this over
drinking
here.
lots of fluids. We don't want you getting dehydrated.
And again, you want to prime
And you have a history
the
of
drip
that.
tube to about halfway.
So you gotta be very careful with it. Do you have any other questions?
And we're going to prime this line.
You got your call light? Alright. Call if you need anything.
And this one, push those air bubbles on out.
Alright. Do you have any other questions, Jessica?
There we go.
Yeah, actually, were there any
Now.
pertinent pieces of information you reviewed before administering the client the medication?
So we reviewed her health history.
You wanna clean
and
this,
reviewed her lab work,
and the
including
IV port
a
is
culture
getting plugged into.
And her WBC.
Oh, okay. Did this information affect your decision to administer the medication?
Yeah, if her
Okay.
WBCs were no longer elevated, we would call
Now
them
we're just
to
going to set this up again, and we're going to select channel A.
Okay.
We're going to do the secondary,
Did this information affect how you administer the medication?
No.
select the alphabetical range it is in. We're going to do imipenem.
Alright, thank you.
We're going to do the 500 milligrams to 100 milliliters. Oh, hit the wrong side. Yes, this is the correct medication. Next. And then we're going to select duration, and this is supposed to be given over 60 minutes, so we're going to 60 minutes. And then I'm going to double check that both my roller clamps are open, and that is correctly open. And I'm going to hit start. And we're going to see. Okay, that's running, and we just want to double check the two drip chambers to make sure we've got 5 drips.
I'm going to make it.
2,
Do you want to put this right away and make sure it's good?
4, and 5. All right, I believe we are done with that, and you look good to go. Is there anything I can get you? I'll be back in a little bit to check on the pump and to answer any questions you might have on the medication.
Nope, I'm good.
You good? All right. Well, we'll see you in a little bit.
That was pretty neat.
Yeah, it's when you first start out working those pumps can be a little nerve-wracking, but you get the hang of it pretty quick.
I do have a couple more questions.
Sure, I'd be happy to answer your questions.
Now, were there any pertinent pieces of information that you reviewed before administering the client this medication?
I checked her most recent set of vitals, and they basically indicated that she did have, they were corresponded to the assumption that she had an infection.
Okay.
So it basically corroborated it and said that the medication was appropriate for her.
Did this information affect your decision to administer the medication?
No, it just reaffirmed that it was the appropriate medication to give to her.
Now, did this information affect how you administered the medication?
No, I administered an IV exactly as it was indicated.
Those are all the questions that I have for you, Joe. I really appreciate you letting me shadow you today.
Not a problem, Annie. It was a pleasure having you along, and good luck in level 1.
Thank you very much.
You're welcome.